Bit of blood back. What are you doing to my camera?
It went off on itself, I don't know, the recording.
You hit record again?
Yep.
So we're waiting for now. You see how the blood's come back? We're going to have a nice little bruise there because that was nice and tight on your toe, but that's okay. That'll go.
So are you happy enough you know what to do? Yeah. When the anaesthetic wears off, take whatever painkillers you'd normally take. We'll see you back on Thursday and keep it dry in the meantime. We have an advice sheet now we'll give to you. And we'll write on the bottom of it how much local anaesthetic we put in your toe. So if it's a thing you do need to go to your doctor or anybody else, you can tell them what we've done for you today.
So I'm not washing her foot. She's going to have a yellow foot. You're going to have a yellow foot for a couple of days, all right? Because I'm more interested in getting the dressing on and keeping this clean than actually washing the foot. What do you think?
I always wash the foot.
Oh God. That's why she can work in private practice.
So the foot's fine, be yellow for a few days.
So you can?
Actually, I stopped mine washing it today because they were washing other parts of the foot and then going back to the wound.
Oh, okay.
Look, if you get the dressing on and the tape on, and you can tidy the rest of the foot up with an alcohol wipe, that's good for you. But if it's an open lesion and you're washing it, then what are you doing? Do you know what I mean? Mm-hmm. So I'd happily send you home like this because you'll wash it, and it's great. Actually, you get a lot more sympathy. So what I normally say is, go home, take your sock off, put it up on the couch, and they'll run around you like a blue ass fly. You won't have to do anything in your house, but you probably live with people in the room, so they've heard me say it now. You know the way, so you're in trouble. Right, so I'm checking now, so I'm happy enough. Look, there's no bleeding, the rest of the nail plate's intact. There's no nail there, I've got left no chemical, there's blood back to the toe, so I'm happy to dress it. Because remember we're occluding it, we can't see it for a couple of days, and neither can she. So we're happy, aren't we? So once we're happy, then we dress it. So I can pick these up. So what I'm going to do is I'm going to fold this in half. This is a Mepital dressing. Comes in quite a big space. So rather than chopping it in half and making a mess, I'm just going to fold it in half. This is sticky. So I'm just going to put it over the whole toe. So remember, I've got surgical gloves on. So this is a different technique to what you're used to, isn't it? Because this is minimum touch as opposed to no touch. Take 2 pieces of Calcistat, 2 pieces there, pop it straight on. So again, I'm not pressing on the surgical area with my fingers because it's not good practice, but hold it there. 2 Malin or whatever the Medipad, whatever the cheapest I can find is, and hold it in there. So now I can touch it because now we're not getting anywhere near the wound. That's a secondary dressing. So what I might do is, you do a bit of tape. Yeah, so we use a bit of tape on this because you want this to be secured in the right place. This is a big no-no if we're doing it the old way, the non-surgical way, isn't it? So now I'm non-surgical. As soon as I touch the tape, that's the first time I've not touched anything that's been clean, yeah? So I can't go back to the surgery site now, so you have to bear that in mind. So if all your dressings fall off, you're in trouble, so just take your time. So I'm just securing that to the toe. So making sure that they don't meet in the middle because you don't want it to wrap around the whole toe. So now it's secure. Is this 12 or 01?
01.
01. So it's important it's 01 because we're actually looking for a little bit of compression.
So the smaller one.
Yeah, if you put 12 on, that's what we tell you to do for hallux, isn't it? But what you want in this one is a bit of compression just to stop it bleeding and give it a bit of pressure, okay? So 01, but that means on 01 on a 12 applicator, you've got to give it a bit of stretch. So I go side to side so not to cause trauma to the toe that I've just operated on. Let go of the applicator, pull it down, pull up and twist, and then expand again and go again. Actually, that's crap, so I use my fingers. Those plastic ones aren't great. Well, you get what you pay for, don't you, Linda?
Yeah, the rubbish, the plastic ones. So sometimes I take out sometimes in this clinic, I don't know if you still do it, I use the tube gauze applicator to put on the tourniquet.
Oh yeah, absolutely. If it doesn't go on, it's we had trouble with it, didn't we?
I just put that between the toes.
Oh, right.
That's what I
Sorry, that was lovely. So this is where it comes down to different techniques. Doesn't matter. Linda prefers that. I don't care. It's great, but you can do another one if you want. If there's another one there, banana strap, and look at that. That's a perfect example. Well done, Mrs. McHugh.
Done.
Right, so we're done. Is everyone happy enough? That's what nail surgery is.